Now, here's Laura Windsor with a report on autism and sensory processing.
Many children with autism have what some specialists call sensory integration issues. We spoke to Kelly Mahler, a pediatric occupational therapist. She is the author of High-Functioning Autism Spectrum and Related Disorders and Sensory Issues. In order to understand autism sensory processing, it is important to be familiar with all 8 senses.
From the time we're young, we learn that we have 5 senses: smell, sight, sound, touch, and taste. And there are also 3 other hidden senses that we don't really learn about. They're the secret senses. So the first unfamiliar sense is the sense of vestibular. It's our vestibular system, and that's housed in our inner ear, and it's our sense of movement, and it tells us, are we moving, how fast are we moving, and in what direction are we moving. The second lesser known sense is called proprioception, and it helps us to know where our body is in space and how our body is moving without having to look. So if I hold my arm up to the side like this, I don't need to look at it to know that it's straight out to the side, bent in a 90-degree angle. And then finally, the third lesser known sense is called interoception, and that is just our ability to feel the inside of our body. And it's really important to help us know when we're hungry, when we're thirsty, when we need to use the bathroom, and so forth. Sensory processing just relates to our 8 senses pulling information in, sending it to the brain. The brain does a lot of really fancy work with it, and then helps us to respond to that sensory information. In individuals with high-functioning autism spectrum disorders, also known as HFASD, they can have a lot of different difficulties with sensory processing, and one of the most common sensory challenges that we see is called sensory modulation, and that's just basically their ability to respond to the incoming sensory information. And their responses tend to be very extreme. Sometimes the incoming information can be very uncomfortable to downright painful for them, like things that we take for granted, like the feeling of a tag in our shirt or the seams in our socks that we don't even pay attention to can be painful for these individuals. Or if someone comes up and just touches them lightly on their back, that can feel like a painful punch to them and send them into almost a panic mode, a fight or flight response. All this sensory information coming in and just overwhelming their body, they go into what we call sensory overload, where their body just starts to shut down, and going through daily tasks can be a complete nightmare for them. The opposite end of that continuum is individuals with autism spectrum disorder can be under-responsive to sensory information, where it seems like they're almost oblivious to the sensory world. Sensory processing can be very tricky, and it changes depending on our level of stress, how much we slept the night before, how our day is going. It really has a lot to do with how much sensory information can we tolerate. Up to 90% of individuals with autism have these difficulties.
What can be done to support sensory processing needs?
One is adapting the environment, adapting the tasks, trying to embed strategies to help them be as successful as possible in their environments and with their everyday tasks. And when possible, try to recruit an occupational therapist that is very knowledgeable about sensory processing, because that can be very, very important to the process. And number 2 is educate. Educate everybody surrounding that individual with autism, help them to understand sensory processing so that they can try to understand maybe a behavior that we might be seeing could be due to an underlying sensory difficulty. And also educating the individuals themselves with autism is so very important, and a really big missing component today in our interventions is empowering them with information about their sensory processing needs, their strengths, what's going on in their body, so that they can start to really adapt the environment themselves, and they can start to advocate for their needs.
If you feel that your child has an autism sensory problem, consult with your medical team for the proper diagnosis and therapy. For the American Health Journal, I'm Laura Windsor.